Welcome to today's edition of From the Mayor's Desk. This is Mayor Lester Preston, and I'm here today with the Chief Medical Officer from Centrastate Hospital, Dr. James Matera. Doctor, thank you for joining us today.
Good morning, Mayor. Thank you for having me.
I can only imagine how busy you must be with everything that's going on, particularly here in Freehold Township and the county. So I appreciate you taking time out of your busy day to spend a few minutes with us to give us some information about the coronavirus.
Absolutely. Community means a lot to us, as you know.
It's the hot topic, so it's always nice to bring an expert in and have them talk to us about what's going on and what we can do to make the public safer. So that leads me right into my first question. What can the public do right now to stay safe from this?
Right now, the best thing that we have available for people to stay safe is social distancing. That's the most common way to prevent this virus from spreading. And that's what we've all heard about in the news. There's been a little discrepancy out there as to what social distancing is, who should do it and who shouldn't do it. But we clearly know that keeping that 6-foot distance from another person will help, because this virus can be spread through the air. So you want to stay away 6 feet as much as possible. That's the key way to stop the progression of this disease. They should really stay inside. That's the important thing. Only travel out for any absolute necessities that they need, food, clothes. But the regular order of business has to come more to a stop. That's what we have to do. And it's hard to do that. We're so used to being so up to date on everything in this country that we want instant gratification. And I know people are getting stir crazy, but I've heard so many different ways of people getting together virtually to do this. And that's really the important thing. Social distancing, keeping that 6 foot away, and staying at home until this is passed.
Okay. One of the things that a lot of people have talked about, and I know we've talked about it here in the township, is the transmission of the disease, symptomatic versus asymptomatic. There's some new CDC guidelines coming out that say even if you are asymptomatic, you can transmit the disease, but generally they're saying that's not a primary mechanism of transmitting.
Yeah.
So can you just talk a little bit about, and I know it's very hard because there's so much data that has yet to be collected about the number of cases, but generally, what are your risks of being infected by someone who is asymptomatic versus someone who is symptomatic?
Yeah, and that's a tough question, because the incubation period of this virus, and what an incubation period is, from the time you're exposed to the virus to the time you develop symptoms of the virus, can be as low as 2 days and as high as 14 days. So there's a potential in that whole time where you could be asymptomatic but still be a carrier of the virus. So again, that's where social distancing helps. So keeping that distance from people at this time, whether they're symptomatic or not. Symptomatic, we certainly treat a different way. But that key incubation period is when we really need to be prone to this. So if we all abide by that, even if there are people, and we know that there's going to be people out among us who have been exposed, that's going to lessen the exposure.
Right. And I think particularly here in Freehold Township, because we know there is what I would call a cluster, but there's a very specific reason for that cluster. So, the social distancing and maintaining your 6 feet, I think, is ultra critical. I know it's hard for people because we're so used to coming up and shaking people's hands and saying hello and being a social society. So, I think that's great advice. Don't shake hands. I met you for probably the first time today. And your initial inclination is to go like this, and then you go like this.
And then you pull back. Yeah, it is a different world, but to maintain that social distancing and that home, you hate to say the word quarantine, but the more you can stay at home, the better off you will be. And ultimately, hopefully this will wane. We've seen it in other countries where it starts to wane out after a period of time. We can't speculate on if the worst is yet to come, but we have to take each individual day as it is and take care of the patients.
And I think as we get more and more testing done and the results back, I know that's been a problem. The delays with the testing centers, because they're just overwhelmed, right? They're used to doing X amount of tests overnight, during their process, and now they're getting multiples of that. So that doesn't help the situation, but hopefully that will kind of start to ease a little bit as they become more proficient in what they do as it relates to this virus.
And we are seeing state centers open. There was one in Bergen County. There's one at PNC that opened yesterday. They're by and large being overwhelmed also, because the theory behind that is you can't just drive in and get a test. You have to have a prescription. You have to have an appointment. But so many of these places are getting inundated with people driving in, and that puts excess strain on it as well.
So What are the symptoms of COVID-19, and what should we be looking for in ourselves and our family members to kind of?
Sure. The key ones are fever. That's almost universal in these patients. Cough, shortness of breath, and profound weakness, very similar to flu-like symptoms that you would see. Those are the common ones, but we've also found other things such as diarrhea or nausea, GI symptoms that precede sometimes the more serious respiratory symptoms. By and large, the main harbinger or the main difficulty with this disease is the respiratory system.
Right.
But we have seen some prodromal symptoms or symptoms like diarrhea that come from that. Also, sore throat, headache. You may see those as a precursor to some of the more serious symptoms. But the ones that really require the attention are the fever, the shortness of breath, the fatigue, and the.
So those last few, would they be the type of asymptomatic things that you might refer to that would?
Yeah, because those are all these symptoms are non-specific.
Right.
But certainly, if someone that was to develop diarrhea right now, they wouldn't automatically say, well, I might have the COVID virus.
Right.
But we may see that prior to them getting other symptoms.
Okay.
Correct.
And who is most at risk? We see a lot of, everyone has seen the news clips of the spring breakers down in
Yes.
Florida, the kids congregating in the streets at Mardi Gras.
Yes.
And they think that they're not at risk.
They are, and anybody in congregations like that, and Mardi Gras is a good example because if you look at the uptick in New Orleans in particular after that, you can certainly see it. The ones that are still at risk, and the reason why the younger people have to adhere to quarantining and social distancing, is our patients who have other medical conditions, primarily diabetes, which we know is rampant in our society.
Right.
We've done a lot at Centrastate to try to combat that here in
Yes.
Freehold. But those patients, heart disease, anybody who has other medical conditions, hypertension, those are going to be the at-risk patients. The younger people, two interesting things are happening. We are seeing some younger people getting sick, but we're also seeing them as a potential for transferring a virus to an older person. So if they're congregating in large groups and getting the virus, even though they may not have symptoms, they could be passing it on to family members and such. So the risk patients are the ones that we're seeing, but there's been a little bit of a mix with other patients who we wouldn't expect to be seeing problems with the virus that we're seeing.
But generally, you're going to lean towards the older population, those that have compromised immune systems.
Yes. Those are,
underlying medical conditions are probably the most at risk. I think we're all at risk is a fair statement to make.
yes, but the ones that we're going to be most concerned about are the patients who have difficult time handling things like this,
Right.
and may have a lack of reserve, whether it be from heart disease, whether it be from diabetes, other medical conditions that go along with that. Those are the ones that we're going to see presenting with more serious disease.
Okay. And if someone suspects they have COVID-19, what should they do?
Primarily, we want them to call their primary physician. And we know we're in a different world now because a lot of primary physicians are doing telemedicine visits, which is also good. But the primary care physician can go through some screening questions with the patients to see if they think they're at risk. Then they have to contact the state or the local health department to let them know. The doctor may then try to get a test for the patient and try to go along those ways. But many times they'll say, to stay at home, chart your temperature twice a day, make sure you're not starting to develop a fever, limit your contacts, social distance, stay in the house, monitor for any symptoms. Certainly if their symptoms get worse, they can come into the emergency room. We can handle those patients. But generally, as a rule of thumb, we're not taking patients currently to test them.
Okay.
We want them to go through their primary physician
Okay.
and perhaps some of these other centers. As time goes on and the testing kits become maybe a little bit more available, that would be a possibility.
Right. One of the other things that we're hearing a lot is I've come into contact with someone who's tested positive.
Yes.
I'm not showing any symptoms, but I know that I've been in contact with someone. Can you just talk about what do we do with that if you're one of those people?
That's a very good question. What we do then is we tell them to stay at home, check their temperature twice a day, as I just mentioned, and to contact the local health department because they will be the ones who will track these patients for any further development. So that's really the key factor for that.
Great.
We're dealing with this with healthcare workers too, because if healthcare workers by definition are going to be more exposed perhaps, what do we do with a patient or, I'm sorry, a healthcare worker who's exposed? how do we handle those? And that's an area that we're working with very diligently, because of course we not only want to keep the community safe,
Right.
we want to keep our healthcare workers, all the ancillary staff at the hospital that makes it, run day by day.
Sure.
We have to keep them safe as well.
Yeah, it's funny that you say that. One of the things that people are reaching out to us. What can we do to help the hospital? Can we make them masks? Can we get food to the workers over there? Everybody's looking for an outlet to help. What are some things that we can do to help the staff and the people at Centrastate?
Sure, and that's one of the best things about this community is they've rallied
Right.
for our support. So we do have some tents set up by one of our off buildings on the campus that we're accepting donations. Restaurants have been donating food, people have been donating masks. We do have on Building D on our campus, we have a drop-off center for many of these things. And anybody who has information on that, we've got people who are sewing masks, we've got people giving us leads for availability of PPE or personal protection equipment, which is in limited supply.
Sure.
And we're following up on as many of those leads. Unfortunately, as you know, we hit some fraudulent ones, so we have to screen those very carefully. But we're always looking for leads on that. So our community health line, which we'll be putting up, you can call that number if you want to donate anything, and we'll get it to the appropriate people.
That's fantastic. My next question. I can get information anywhere, right? I can
Yes.
get it on Facebook. I can get
Yes.
every social media site out there has an
Yes, you can.
expert. Where should we tell people to turn to for information?
Yeah, the key factor is the CDC. That's our governing body, and they have a very accessible website, cdc.gov. You can click on Corona. They have guidelines for us as healthcare workers, but they also have public guidelines. And that's what we're using. And these are guidelines. This is an evolving situation. We only started to hear about coronavirus in around December.
Right.
So we don't have the wealth of information as we do about the flu.
Sure.
So we do look at this. But CDC is one. Certainly at Centrastate, we have a website, centrastate.com, where we also have links to different things in your community, ways to look at that, and our community hotline for any questions. That's really the key. Facebook may have some good information, but oftentimes it's more opinionated
Right.
based on things. So I would stick with those governmental helplines.
Well, we appreciate you taking time out of your busy schedule, Doctor, to come in and spend a few minutes with us to help us spread the news. As I said, you can't stress enough the importance of social distancing.
Yes.
It's very hard. My wife will tell you she's kind of been locked in with me for a couple days, and she's not so happy right now.
Yes.
But it's I think a small sacrifice we all need to make for the greater good of the community and
Yes.
for everyone around.
Well, one of the best things I've seen on social distancing is with the basic shutdown of the entire sports world. There was a joke that the gentleman looked to, he saw this woman on the couch sitting next to him and realized, hey, that's my wife. So yes, stay inside, social distance, let this run its course, do the best you can to keep everybody healthy. We're certainly doing that at our hospital, and we will continue to do so. This is a wonderful community. I grew up in Monroe. I've been in Freehold here as a physician for almost 30 years. We're dedicated to this area, and we're going to help in any way we can.
Well, as you know, the township has had a great relationship with everyone at the hospital. We're proud to have you as part of our community and our friends. Anything you need from the township and our residents, don't hesitate to call. People are looking for outlets, and anything we can do to help,
We will.
we're there for you.
Absolutely.
Doctor, thank you for coming in. We appreciate it.
Thank you for having me, and look forward to talking to you again in better times.
You got it. Thank you.
Thank you.